Good morning, ma'am. I am Rogine Latorino, BSED TLE4B, and I am the one to discuss the rational emotive behavior therapy, its proponent, and the history. So my other members will discuss the step-by-step or the stages of this counseling theory. So rational emotive behavior therapy. So it is evolved from the work of psychiatrist Albert Ellis in the middle of 1950s, in the mid-1950s, so as the original form of cognitive behavioral therapy. So Ellis believed that most people are not aware that many of their thoughts about themselves are irrational and negatively affect the way they behave in important relationships and situations. So according to him, it is these thoughts that lead people to suffer negative emotions and engage in self-destructive behavior. So, one of the solution of this problem, according to Ellis, is to let go of the negative thoughts and replacing them with positive beliefs. So, everyone is able to accept oneself and others and in turn live a happier lives. So the history of rational emotive behavior therapy. So why nga naamay rational emotive behavior therapy karon sa counseling theories. So kani si Albert Ellis, as a young man, Ellis found himself longing for companionships yet experienced a severe fear of talking to woman. So naa siya fear nga makigstorya sa babae. So in order to tackle his fear, Ellis decided to perform an experiment. So for a month, he visited a nearby park and forced himself to talk to 100 different women. So over time, Ellis found that his fear of speaking to women had diminished considerably. So the fear of Ellis is gone. So this experience served as a basis for developing his approach to therapy. So combining behavioral strategies with assessing underlying thoughts and emotions. So according to Ellis, people are not disturbed by things but rather by their view of things. Kung unsa nila pag-perceive or pag-view ang usa ka butang. So the fundamental assertion of rational emotive behavior therapy is that the way people feel is largely influenced by how they think. So kita mga tao, di ba? Kung unsa atong bation mo may ato gihuna-huna. So kung maghuna-huna ta nga di ta ganahan na niya, so di gyud ta ganahan. So mo na siya. So when people hold irrational beliefs about themselves or the world's problem can result. So problema jud na. So the goal of rational emotive behavior therapy is to help people alter illogical beliefs and negative thinking pattern in order to overcome psychological problems and mental distress. So by the 1950s, Ellis had started experimenting with other types of psychotherapy. So muna na siya, yan na nag-start ang rational emotive behavior therapy, which is, ang goal ni Ellis is to help clients manage emotions, cognitions, and behavior. The rational emotive behavior therapy was one of the very first types of cognitive therapies. So Ellis first began developing rational emotive behavior therapy during the early 1950s, as what I've said kaganiha, and initially called his approach rational therapy. So kani siya ang REBT or the rational emotive behavior therapy is ang tawag pa niya sa una is rational therapy sa katupang 1950s. So in 1959, the technique was renamed rational emotive therapy and then became rational emotive behavior therapy in 1992. So Albert Ellis continued to work on rational emotive behavior therapy until his death in 2007.
Morning, ma'am. I am Melu, Yvonne, and Jopia, and my topic that I am going to discuss is about the ABC model. So these are the three guiding principles of rational emotive behavior therapy or REBT that Ellis established, based on the notion that we are typically unaware of our deeply embedded irrational thoughts and how they affect us on day-to-day basis. So to explain this process, Ellis developed what he referred to as the ABC model. So the first is the activating event or adverse event. It is something happens in the environment around you. So activating event, it is important to identify the situation or event that triggers the negative emotional and behavioral response. For example, say an individual feels continuously plagued by feelings of rejection. So rational emotive therapy might uncover that he or she harbors the following belief: that I am an outcast, nobody likes me. So as a result, this person is likely to interpret a number of everyday occurrences in a negative light. A downcast expression seen in other face, or a lack of positive feedback from a colleagues, becomes a direct reinforcement of that core inner concept. So naturally, this trigger a negative emotional response and increase likelihood of depression, social anxiety, antisocial behavior, and or low self-esteem. So among other manifestation of the nobody likes me belief. So in the case of my example, the activating event, there is a downcast expression or lack of positive feedback from a colleagues. So that event will trigger him that kanang magkahimo siya ing anak nga belief tungod ato nga mga paghitabo nga kanang naka-feel siya rejection nga kanang perminti na lang siya maka-feel og ing anak kanang i-reject siya as a person na mamuoto sa iyang hunahuna sa iyahang nga ing anak siya nga wa jud ganahan sa iyaha. Mo nay naka-trigger niya nga event nga mga panghitabo. So second is belief. So belief, it is you hold a belief about the event or situation. So this is the core belief that are attached. The emotional or behavioral response must be identified and examined. So sa ako ang gihatag nga example, the core belief would be I am an outcast, nobody likes me. So a therapist employing the rational emotive behavior therapy techniques would guide a person to explore where this belief originate and develop a plan for recognizing and replacing them with positive affirmation. So this kani siya nga guiding principle, mao na ni siya ang katong namuo sa iyahang thoughts, katong kung asa katong ingon siya nga nobody likes me ana, mo na siya nabutang sa iyang una kay tungod sa paulit-ulit nga nahitabo sa iyaha nga rejection. And then ang the therapist ani sa rational emotive behavior therapy, mo na ang iyang kuanan, ang buhaton ana niya na mga nga techniques is kailangan niya og kanang i-explore niya ang patient kung asa jud na siya gikan nga belief niya nga iyang gituha, asa na siya gikan, asa unsa nga kana panghitabo nga naka-trigger ana sa iyaha. And then i-replace niya into positive affirmation. So the third is the consequences. So consequences is you have an emotional response to your belief. So this is the combination of the activating event and the core beliefs will produce a result or consequence, such as depression, social anxiety, antisocial behavior, or issue with self-esteem.
Good morning, ma'am. Good morning, classmates. My assigned topic is the basic tips and reads or the rational emotional behavior therapy. The first tips is is the identify irrational thought patterns and belief. You need you need to identify the feelings and the beliefs that leads to psychological distress. So according to Elise, some of the most common irrational beliefs are feeling excessively upset over other people's mistakes or misconduct, believing that you must be 100% competent and successful in everything to be valued and worthwhile, believing that you will be happier if you avoid life's difficulties or changes, feeling that you have no control over own happiness, that you contentment and joy are dependent upon external forces. So once these feelings have been identified, the next step is to change the mistaken belief. So this is the second step, the challenge irrational belief. According to Elise, that rather than simply being warm and supportive therapists need to be blunt, honest, and logical in order to push people towards changing their thoughts and behaviors. If the patients or the clients feel comfortable to you as her or his therapist and build a trust, that time they change their thoughts, beliefs, and behaviors. And the last steps is to gain insight and change behavior. Once the patient has identified the problematic belief, it is the process of changing. In these last steps, you need to have the response of the patient that can make his or her realize that it's not realistic to expect success in every endeavor. If the patient's response to the situation, you gain insight and change the behavior of the patients, because everyone makes mistakes, but all had to do is learn from the situation and move on. That's all. Thank you.